now is to talk about motion sickness, and you can see the other names. So motion sickness, it depends on where it happens. It happens because some disconcordance between the vestibular system, the motion, and what the eye see. This disconcordance causes the feeling in motion sickness that usually manifests with nausea, vomiting, and abdominal pain or uncomfortability. It usually happens when someone does something that causes motion that is not coordinate between the systems. So for flighting, it's quite rare, but for shipping in very rough sea, it's quite common. You can see the incidence for under 1% for airplanes to nearly 100% in ships in very rough seas. So the etiology is not totally clear, but it's, as we said, uncoordinate between the vestibular system, what the eye see, and the motion the patient feels. Therefore, for example, it may be exacerbated if the patient is in the ship and looking at the cabinet that is not moving when the ship moves. This is also the reason why it is advisable to look to the outside world, to where the motion is happening when you are moving in a ship, in a vehicle, in an airplane, to see the motion. So the ophthalmic system will be concordant with what you feel in the vestibular system. There are risk factors where are poor ventilation, emotional factors, migraine, vestibulopathy like labyrinthitis, and hormonal factors like pregnancy and oral contraceptive pills. Space adaptation syndrome is something that happens to astronauts where they need to adapt to the new environment where there is zero gravity. They also feel quite the same. And symptoms, as I said, it's mainly nausea, vomiting, pallor, diaphoresis, vagal abdominal discomfort. These are the motion sickness symptoms. But be aware, there should not be any shortness of breath, any focal weakness, any neurological deficiency, any visual or speech disturbances should not be. You can think about other etiologies like CNS hemorrhage, cerebral infarction that can cause those symptoms, like neurological symptoms, focal weakness. This should not happen in motion sickness. And the treatment is drugs that can use as prophylactic adaptation and some adaptation with behavioral, like sitting in front of the window so you can see the motion, or adapting to the situation, namely repeating the insight event like shipping again and again, so the body can adapt to the situation. Or you can use also medications, as you can see here. There are the prophylactic medication like scopolamine, anticholinergics, antihistamines, the first generation because they have anticholinergic effect. The second generation, are not really effective. Dopaminergic drugs, especially phenergan, promethazine, what is also called. Non-drug prophylaxis, we said. Antiemetic medication like metoclopramide or ondansetron, Zofran, sometimes IV fluids and electrolyte replacement. Don't forget that from nausea, vomiting, repeated vomiting, the patient can get dehydrated and may have electrolyte disturbances. So scopolamine is anticholinergic. It can be used as a preventive. There are a transdermal patch that can be used posterior to the ear for 72 hours. It is effective. It takes about 4 hours until it takes effect. After 72 hours, if the patient needs another one, he can take another transdermal patch and put it on behind the other ear. And you can also use scopolamine as an oral form, as you can see here. Again, take it before the event, 30 minutes before. Those are the dosages, 1 hour before, and uh, every 8 hours as needed. Now, remember that it is an anticholinergic drug, so it can have anticholinergic effect, like dry mouth, blurred vision, and not bradycardia, tachycardia. I don't know why they said bradycardia. But remember that anticholinergics are not really they can delay the pupil because they are like sympathomimetic or parasympathetic inhibitors. And remember that patients with acute angle closure glaucoma, when you delay their pupil, they can precipitate acute closed angle glaucoma by the pressure that uh, the liquid in the posterior chamber, when it is trapped between the iris and between the iris and I forgot the name, the lens. So it can cause acute closed angle glaucoma because the posterior chamber liquid is trapped. It causes the iris to go forward. It can close the angle between the iris and the cornea, closing the trabecular meshwork, closing the Kalan of Shalen, and causing increased IOP acutely and causing acute closed angle glaucoma. So dilating the pupil by scopolamine can precipitate the patient for acute closed angle glaucoma. So it is contraindicated in patients with increased risk for acute closed angle glaucoma. So remember this. It usually for adults above 12 years old. Antihistamines, you can see those antihistamines, travamine, demigramine. Those are first generation antihistamines with anticholinergic effects, so not the newer generation. You can see the dosage right over here. Again, they are taken before the departure, 1 hour before, and you can see for how long each works. Don't forget that it can cause anticholinergic effects, and also don't forget that they can be sedating because they are first generation antihistamines, so they can cause sedation. Also, something that is important to remember for scopolamine that it can cause toxicity. So, if an older patient become confused and develop fixed dilated pupil, think about scopolamine, but also think about neurological causes because this is the most devastating ones. So, if he has dilated pupil, think about even herniation and check for neurological symptoms. Check for focal weakness, one-sided weakness, and all the things, dysarthria and everything else. Antidopaminergic medication, promethazine, can have antidopaminergic effect, and it can also be given again 1 hour before departure in those dosages. It can be enhanced by caffeine. Metoclopramide also has this dopaminergic effect, but it is less effective than promethazine, which is also called phenergan. Don't forget the extrapyramidal symptoms and sedation that promethazine can cause. Benzodiazepine can also be used, but they can cause sedation. Serotonin antagonists like ondansetron, which is also called Zofran, should be highly effective as an antiemetic, but the effectiveness in preventing motion sickness is not really proven. Those are the dosages for a serotonin antagonist, as you can see here. Non-drug measurement, what I said, being in a place with the least motion, like in the middle of the ship at the level C, looking outside, seeing the motion, uh, or in a vehicle, looking outside, seeing the motion, not reading or something. Don't eat too much, don't drink too much, don't use alcohol. If you can, don't not eat and not drink because it is short, so it might be better. Ginger may help, but it's not really proven. An adaptation can occur, but it usually specific to the stimulus. For example, for big ship, so it's for big ship and other way of traveling, it won't really help. And there are alternative treatment, but their efficacy is not proven. Okay, so this was about motion sickness from Manual Professional Edition. Thank you very much. If there are any corrections or mistakes, I'm sorry. And that's it. This is about motion sickness.